Hi, welcome back to my channel. In this video, I will be talking about the maxillary artery. So first of all, you should know that the maxillary artery is a branch of the external carotid artery, alright? Then, and it begins behind the neck of the mandible in the substance of parotid gland. So these both are the questions that are asked. Now coming on to the another set of questions. So first of all, you should know that there are three parts of maxillary artery, alright? So maxillary artery, now it has three parts, okay? First, second, third. Now first is called as mandibular part, second is called as pterygoid part, third is called as pterygopalatine part. Now in the first part, mandibular, you need to know that it is between neck of mandible and sphenomandibular ligament. Now this one is superficial to lower head of lateral pterygoid, and pterygopalatine is between the two heads and it enters the pterygomaxillary fissure. Okay, now let's talk about the talking about the branches starting from the mandibular part. Now in the mandibular part, you should remember a mnemonic called as the Mai, or you can remember it as Meda. So the Mai. So D is deep auricular artery. A is anterior tympanic artery. M is middle meningeal artery. A is accessory meningeal artery. I is inferior alveolar artery. Then coming on to the second. Now in second, you should know that it is the muscular branches of maxillary artery that belong to the second. So deep masseteric artery, then deep temporal artery, pterygoid artery, and buccal artery. Then coming on to the pterygopalatine, in here you need to remember pig pass. So from P we have posterior superior alveolar artery. From I we have infraorbital artery. From G we have greater palatine artery. From P we have pharyngeal branch of maxillary artery. From A we have artery of pterygoid canal, and from S we have sphenopalatine artery. Now there is a question that out of all these, which is called as the artery of epistaxis, that is the nosebleed, that is the sphenopalatine. So artery of artery of epistaxis. Okay, so this is, then we are often asked that which of the following structures originate from structures emerging from. Now if you are asked about the upper border, now from upper border you should know masseteric artery and deep temporal artery and nerve. Basically masseteric artery and deep temporal artery. Okay, then if you are asked about the lower border, now in lower border, for lower border you should remember lingual artery or lingual nerve basically, then middle meningeal artery and inferior alveolar nerve. Then another question is structure passing through gap. So maxillary artery, gap between two pterygoids. So maxillary artery and buccal branch, okay, of maxillary artery. This is basically entering the gap, and this is exiting the gap. Okay, now these are all the important questions. Then one time there was a question, how many total and how many arteries does maxillary artery have? So we have 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15. So basically 15 branches. All right, so these are the usual questions that are asked these days from the maxillary artery topic. So if you like the video, do subscribe to my channel and do like, share and comment. So yeah, but I forgot to discuss the diagram. So first of all, we will start from the first part, right? So in first part I will be labeling it with blue. So in first one you have the anterior tympanic and deep auricular, okay. Then you have inferior alveolar, okay. Then middle meningeal artery, accessory middle meningeal artery. So we have 5, right? 1 2 3 4 5. Then coming on to the next one, middle part. Now middle part is muscular branches. So masseteric, deep temporal, all right. Then we have buccal artery, okay, and we have pterygoid artery also. Now let's talk about the other ones that are left. So in the ones third part, so first of all we have posterior superior alveolar artery, infraorbital artery, greater palatine artery. Then we have pharyngeal artery, artery of pterygoid canal, and sphenopalatine artery. All right, so these are the various branches of maxillary artery with their respective parts. You should know their names, the from where they're passing, their branches, then structures emerging, nerve of epistaxis. So this is the questions that are usually asked from maxillary artery. Yeah.